Okay. Hello, everyone. Good evening. We are going to have this MCQ sessions every night at 9:30 in the night, and then we'll start with some simple things, and then we'll move ahead with the clinical based questions, scenario based questions, and we'll cover various topics. So that is the plan. All right. So if you're able to hear me really clearly, just give me a thumbs up. So I'm Dr. Rohini. I have about 10 years of teaching experience, both in UG and PG teaching. And you can now find me and follow me at RoAqua. You have to download the Unacademy Learners app, and then you can watch all my YouTube videos by using this code ROHINI, and then you can get free access to watch all the YouTube class videos. Like and subscribe if you have understood, liked all the videos that I post. Okay, so now first one. Now this is just a small, quote, or just to motivate you. This is a motivational quote, I can say. What is that something, the tips that I can give you to build your motivation and keep you on track? So that is, first of all, you have to build your core knowledge. You have already learned everything. You have started with your basics, and then you went on for all the second year, third year subjects, and so on. You have gone through all the subjects. You have studied everything. Only thing is you have to build more knowledge based on these subjects. Okay, so you have to increase your knowledge in terms of clinicals and scenario questions. Scenario based questions is something you have to work on. You have to work on a lot of MCQs just to learn to manage your time. So to learn to manage your time, you must work on most of the MCQs relevant to the topic that you have studied recently. So now here, overcome your first year block. What does that mean? You have the first year, you have the basic subjects, anatomy, physiology, biochemistry. These are the things that you should know thoroughly. So if you know all your basic subjects thoroughly, then you will get motivated to do your high yielding subjects. This is one thing I want to stress, and each and every class has to stress upon this, because this is what will keep you motivated. Know your basics well, then you can relate it to anything that is from the clinicals or scenario based questions. Next, regular assessment is of utmost importance. You have to assess your knowledge very regularly. You have to assess yourself. Are you able to manage your time? Yes or no? Are you able to finish the MCQs in the given time? That is very important. If you take a whole lot of time to solve one MCQ, then it's not going to serve your purpose. You will not be able to reach your goal. You will not be able to reach the score that you desire. So it is very important that you do self-assessment or regular assessment of yourself by giving you small, MCQ based tests or quiz. You must take this to know where you stand. And then you also must give extra time for your weaker subjects. Everyone is not good at all the subjects. So you should know what are your strength and what is your weakness. If you're good at something really, if you're good at something, some of the subjects, then you should bank on it. You should go do those clinicals, scenario based questions from that, so that you get even more motivated And then you have to put in more time for the weaker subjects so that you understand better. Or if you think you cannot do it on your own, you take help. You take help from the educators. You can look for the Learners app on Unacademy. You can download it, and then you can look for me for anatomy MCQs. You can look for any help needed by me, guidance from me, and then I'm there for you anytime. You can message, you can join the Telegram app, and also send your queries, send your questions, and we can solve your queries. So you have to look upon all these things, and then you have to get help through your educators if you are weaker in any particular subject. Then don't ignore the previous year question papers. So question papers and many MCQ based questions previous year, you may think that previous year may not come, may not be asked. That is not so. You have to look at all the previous year questions so that you get familiar with the questions or the pattern of the questions. Okay, let's see if anybody is okay. We have Malikan, we have Shane, and we have Rishabh. Hi. We have some more. We'll come to you. Just give me a second. Let's see why. Okay, let's hit the first question. Let's see what we have in the first question, because this is purely MCQ based. I'll give you time to think and connect with me. So first question. So this is, most of the questions are from what is already covered. That is the osteology portion. Most of the osteology we have covered. So this is what we are going to concentrate more on. So in the anterior view of the viscerocranium, which one of the following bones is single? So you have two portions. One is called the neurocranium, another one is called the viscerocranium. So we are talking about viscerocranium. Okay, we are talking about the viscerocranium. So this is neurocranium. What is meant by neurocranium? It forms the protective case. You can see all these bones that form the protective case of the cranial vault. So you have this cranial VAULT vault. All these bones, the individual bones, all these are known as cranial bones. And they form part of the neurocranium. And then there is this bone, that is frontal bone, that belongs to, actually it belongs to the viscerocranium, that is one of the facial bone. So now this is one thing that we are going to talk about. So this is the viscerocranium. One second. Okay, so now the first question is, in the anterior view of the viscerocranium, which one of the following bones is single? Now, first one is, this is the anterior view, and they're asking about which bones are single. Is it the nasal bone? Is it the frontal bone, lacrimal bone, maxillary, or zygomatic bone? Which one is single? So they're asking about which one is single bone, or it is not a paired bone. So here we can talk about the viscerocranium, all these bones, and we can pick the answer as the B, that is frontal bone. So frontal bone, you have the right and left bone, but there is a suture that holds them together. Okay. So sometimes the suture will persist, and that is called metopic suture. And sometimes this suture will persist. This is supposed to close by the time the baby, turns from 8 years of age. It is supposed to close. Before 8 years, it's supposed to close. If it persists, then it can lead to a lot of confusions in reading the X-ray. So it could be actually confused for a fracture. So this is the answer, that is frontal bone. Okay, so now we have Gaurav Malik. Hi, you can try to answer. Yes, the answer is B. So many have written Jaidev Solanki. Yes, it is the HIPAA. Yes, metopic suture. Your answers are correct. That is, answer is B, frontal bone. All right, we'll move on to the next one. It's always nice when it is interactive, when people are answering, when people are reading the questions, understanding, then answering, it becomes even more interesting. So now you're making it very interesting by, when many people are joining and trying to guess the answer. So now here, what is the strongest bone among the bones of the face? Now you have this nasal bone, you have frontal bone, you have maxillary, zygomatic, and the mandibular bone. So now which one do you think is the answer? So now who is going to answer this? We have someone by name Future Doctor. She says E. Is it E? Who else says E? Saini, E. Okay, we have Indrani who says E. Yes, you're right. It is mandible. It is the largest and strongest bone. Because why do you think this is the answer? Why do you think this should be the answer? First reason would be because it has this alveolar arch. Okay, so this is one thing. So that adds this extra body to the mandible. So that is one thing. And there are so many, and it also adds depth to the mandible. So this one adds depth to the mandible. And there are so many muscles of mastication. You know that the muscles of mastication are very strong. These are all very strong muscles, and these muscles are very powerful. And we have TM joint. Okay, the mandible, actually it forms a TM joint here. There are two processes as we have discussed before. This forms a TM joint. So since it forms TM joint, there are ligaments that hold this mandible to the TM joint. So because it is a complex joint, and then why do you call this a complex joint? Anybody knows? It is a complex joint. When do you call it a complex joint? Yes, Kipa? Just trying to say something. Complex joint is when you have more than two bones articulating. Okay. So you have more than two bones. You can say more than three bones. Sorry, more than three bones articulating. Plus, you also have a disc. So here you have articular disc. What does this articular disc do to this TM joint actually? It divides the TM joint into two compartments. There is a compartment above, there is a compartment below. So there are two movements happening. There is a compartment above, so that provides you sliding and gliding movement. This is very, very important from your exam point of view. So you have sliding and gliding type of movement. And then there is a compartment below. So this will have retraction. This have elevation, sorry, and depression. What is actually sliding and gliding? I'm talking about protrusion and retraction. So protrusion, That is forward movement of the mandible and backward movement of the mandible is known as protrusion and retraction. And that is possible in the above compartment. And there is a below compartment that is between the articular disc and the head of the condylar process. And that here it will be another movement, that is elevation and depression. So there are two different movements happening at two different compartments, and that is the articular disc. And such joints where there is three bones and then there is articular disc also involved, and this kind of joints are called complex joints. Okay, so now here there is more than two joints. Yes, Kipa, you are so right. Next one, superior orbital margin. Now we have the superior orbital margin. Where is the superior orbital margin? On which bone it is formed? Is formed by which bone? Now we have the answers. Options are the orbital, the maxillary, the zygomatic, ethmoid, and the sphenoidal. Now I have put a picture of some bone. If you can identify the bone, your answer will become even more easy to guess. So which bone do you think this is? This bone is, anybody? Yes, this bone is A, that is the frontal bone. We have Saif and Sam answering it as A. So this is the frontal bone. Now here it is there is one interesting thing that you have to know. I'll give you a little explanation. What are the parts of the frontal bone? It actually has these three parts. It has the squamous part. It goes and articulates with the parietal bone at the back like this. So that is squamous part. And then we have nasal part. And then we have the orbital part. Okay, so now we have squamous part articulating with the parietal bone. What happens to the nasal part? So nasal part is coming downwards and it goes to the nasal bone. And we have orbital part, which also has this orbital plates. Okay. So now you can see that this is the orbital part. It continues downwards as orbital plates. And this is what we are talking about. So the answer is the frontal bone. These are the three things that is present. And it forms the superior orbital margin, frontal bone. This is one thing it forms, superior orbital margin, and it also forms the floor of anterior cranial. Where is the anterior cranial fossa? Just above this will be the anterior cranial fossa. So the orbital plate here, just above that will be the anterior cranial fossa. So it forms the floor of anterior cranial fossa, and the frontal bone is the answer. That is answer A. Okay. Next, maxillary. Does all these make any difference to you? Maxillary, is it part of the superior orbital margin? No. Maxillary is in the cheek and zygomatic is here. Ethmoidal is actually inside. So you have a ethmoidal bone which has got a perpendicular plate that forms part of the nasal cavity. But it has got nothing to do with the superior orbital margin. So now sphenoidal, so the name itself gives you orbital. So you immediately go to pick the frontal bone because that has a part called the orbital. So you have to pick the frontal bone. What about ethmoidal and sphenoidal? Ethmoidal also won't come in the picture, and this belongs to the middle cranial fossa. So this is also not an answer. This is not an answer. No, no, no. Yes. Okay. So I hope you have understood. Okay, next one. All right, we have fourth question. Which part of the frontal bone contributes to the floor of the anterior cranial fossa? Now we have anterior cranial fossa, middle cranial fossa, and posterior cranial fossa. Now anterior, middle, and the posterior cranial fossa. Posterior cranial fossa is exclusively occupied by occipital. Middle one is occupied by the sphenoid. What about the anterior cranial fossa? Anterior cranial fossa is occupied by two bones. One is the ethmoid bone and the frontal. So you have to debate between these two things. Is there an option ethmoid given anywhere here? Which part of the frontal bone contributes to the floor of the anterior cranial fossa? Here, ethmoid is not given to confuse you at all. Directly, the question itself tells you frontal bone. So you have to know what are the parts of the frontal bone. So you have three parts like nasal part, squamous part, orbital part, maxillary and zygomatic. All these parts are given. So you can see that frontal bone, this is the squamous part. So you have the nasal part coming downwards here. Then you have this zygomatic part going the other way to form the zygomatic arch. And there is a small projection downwards, that is the maxillary. And then here, whatever goes downwards to form the part of bony orbit is the orbital plate. So this is what is orbital plate. And the fourth one has the answer C. So this is orbital plate. Okay. So this answer you are supposed to pick. And who has mentioned the answer is... So many of them have picked. I don't know whether right, I have Rishabh Gupta mentioning it as the orbital plate as the C. And let's see who else picks answer C as your answer. Saini, what was the confusion? You say that it is answer A, that is nasal. No, it is not the nasal part. Nasal part is this one. Okay, it doesn't contribute to the floor of the anterior cranial fossa. So this forms the floor of the anterior cranial fossa. This portion actually will be on the other end. It is by the ethmoid. If you turn the cranial cavity, turn to the cranial cavity, this portion will be occupied by ethmoid bone. So this is not part of the frontal bone at all. So it is this and this. So this is frontal and this is frontal. So this is which part? Orbital part of the frontal bone. So you have to tell the C as the answer. All right, next one. Which part of the frontal bone articulates at the pterion? So now you have, again, we are talking about frontal bone. So we have to concentrate on the frontal bone. Let's see now what are the bones that form the pterion. Okay, which bones form the pterion? Now you have this junction which is called the pterion, and there is another junction. This is called the asterion. Okay, Kipa says B. Is it true? Kipa says B is the answer. Let's see. Just wait for a second, Kipa. I think you are right. Let's go with all the options and see whether it is correct. Which part of the frontal bone articulates at the pterion? You have this portion that is going upwards. I told you there are many parts. This one is known as orbital part, and this one forms the part of zygomatic arch. And then you have the maxillary part, and then you have the nasal part going downwards, the one which going upwards to meet the parietal. I already mentioned that is the squamous part. So where is the metopic suture? Metopic suture will be on the squamous part of the frontal bone. So the answer here would be B, squamous part. So it is not the nasal part, it is not the orbital plates, it is not the maxillary or the zygomatic process. The answer is squamous part of the frontal bone. So frontal bone, this part of the frontal bone articulates with the pterion. Now what is pterion? How many of you know what is pterion? Yeah, your option is correct, Rishabh. It is B, that is squamous part. What is pterion? Pterion is nothing but it is a meeting point of four bones. What is this bone? Parietal. And then you have frontal. And then you have temporal coming from here. And then you have sphenoid. Which wing of sphenoid? This is greater wing. This is very important. Greater wing of sphenoid. What about this lesser wing? What is that form? Lesser wing forms a small portion and that is known as jugum sphenoidal. So this is the only thing the lesser wing forms, and this is where the optic chiasma will cross. So optic chiasma. That is the only importance of lesser wing. Okay, it is not a part of pterion at all. So the part of pterion, yes, it is H-shaped, Ripa. You can see that it is H-shaped, and the lesser wing is not part of this. It is the greater wing. So this was one of the questions in NEET PG. So you must remember which wing of sphenoid takes part in the pterion. That is junction, H-shaped junction. And this is about 5 centimeters from the zygomatic arch. This is zygomatic arch and this is about 5 centimeters in length. Okay, so now this is where you know that the middle meningeal artery will divide into anterior and posterior branches. Now you have this anterior branch lying right over this junction. And from where is it coming? It is actually entering the cranial cavity. It is entering the cranial cavity, not coming down. It is entering the cranial cavity. It is the branch from maxillary artery. Branch from maxillary artery. It is entering the cranial cavity, and how it enters through a foramen. Okay, what is the name of this foramen? That is spinosum. Foramen spinosum. So through the foramen spinosum, a branch of maxillary artery enters, and that is the one which divides into anterior and posterior branches. As the name itself tells you, it provides supply to the meninges of brain. So this is the answer. It provides supply to the meninges of brains, and hence the name the meningeal artery. Okay, so middle meningeal artery. Like that, you have accessory meningeal also. So you have auricular, middle meningeal. There are first part of maxillary artery. I'll tell you a small trick to remember the maxillary artery first part. Maxillary artery has three parts: first part, second part, and the third part. So you remember this DAMAI. Okay. So these are the branches actually. So D is deep auricular. Okay. DAM. And inferior alveolar. So these are the branches of the first part of maxillary artery. This is the mnemonic DAMAI, DAMAI. Okay. So you remember it this way. If you remember it this way, you'll never forget that it was the first branch which passed through the spinosum, and then it entered the cranial cavity, divided into two branches, and anterior branch is what lies under this bone, that is the pterion, junction of four bones. All right, we'll move to the next question. Okay, so now who will answer this question? Let's see. Do I have anyone answering? All right, the question is the Metopic suture of the frontal bone normally disappears at about what age? Now you have a picture where this baby is seen with a bump here. Right here, there is a bump. Okay. Can you see this bump? That indicates that there is a suture that is not fused. You have frontal bone, two sides fusing in the center, and that leaves a suture. But that is supposed to close. Actually, if it closes too early, what happens? If it closes late, what happens? You should know both. If it closes too early, then the condition is known as metopic synostosis. It is known as metopic synostosis. It's a type of craniosynostosis. Okay, that results in a triangular head. Okay, triangular head. So you can see that the head shape is all like so much like a triangle, right? It's so much like a triangle. So it results in triangular head, and that is known as triganocephaly. It is known as triganocephaly. All right. So that is one thing. And when is this supposed to close? It is supposed to close between 3 to 4 months. What happens to this? About 30% closes. Okay. So then again, we have 5 to 6 months, about 50% closes. Again, we have some more months, that is 7 to 8 months, where we have about 75% closes. And by the time the baby turns 9 months, it is supposed to close. That can go on and on up to 8 years. So the limit is maximum limit is 8 years. Who answered it as D? How many of you said D? Okay, we have only one who has answered D. Kipa Robin. So you are right. The answer is correct. 8 years. So it can go on up to 8 years. See, I don't think you would have noticed this or read anywhere this portion. So if you want to know some things in detail, you have to always attend such MCQs. You have to discuss with friends, and these things will give you more information. I'm sure most of you knew that it was 8 years as the maximum. But did you know that it starts as early as 3 to 4 months? You didn't know that. So that is one thing. So if it is too early closure, that is before 3 years, this is what happens. It results in something called craniosynostosis condition, and that prevents the brain from growing. Okay, it looks like a triangular head, that is triganocephaly. And you know what is the result of or consequence of late closure? You know that it is going to leave a suture called the metopic suture. Okay. So it is supposed to close. If it is closed, there will be nothing. You cannot make out anything on the forehead. But if it didn't, then it results in this condition called metopic suture. All right, next one. Let's see whether anyone else has answered. Now, Sam says B. No, it is not B. It is not 4 months. It is 8 years. So maximum we are going to take up to 8 years. We are going to give that, take the upper limit, that is 8 years. And only 30% closes at 4 months. So that is not the answer. So all these are not the answers. All right, we'll go to the next one. That is the 7th one. In the anterior cranial fossa. So the anterior cranial fossa, middle cranial fossa, and the posterior cranial fossa. We have 3 sections. And anterior cranial fossa, the cribriform plate is part of which bone? So now here I have put the picture so that you can relate the question, see the picture and then answer. But in the exams, I don't think you will have everything picture based. It will be a question sometimes, or it could be only the picture sometimes. So you have to remember this. The answer Sam has given this time correctly. Yes, Sam, you're right. Kipa is also right. And Rishabh is also, no. Yes. Okay, most of them, yes. Rishabh also says it is D and it is ethmoid. So the answer here you can see, this is the cribriform plate. You can see there are parts actually. So this is the orbital plate, which is coming from the frontal bone. You can see this is the orbital plate of the frontal bone. And this side is also same thing, do same thing here. And then this is given in a different color, that is ethmoid. Ethmoid bone has got this small portion called frontal crest. That is where if it goes above like this, there is a sulcus within the cranial cavity, and that is known as superior sagittal sulcus. For which one? For the sinus with the same name. Superior sagittal sinus will lodge there. And here, this one will end in a small foramen, and that is called foramen cecum. Okay. Next, you have perforated plate, and this is called cribriform plate. Cribriform plate. This is what I'm talking about. And that is present in the ethmoid bone. So what passes through cribriform plate? You have olfactory nerves. They go to form the olfactory bulb. Okay, so that is olfactory nerves, olfactory bulb. So if there is a fracture, of anterior cranial fossa, then easily this cribriform plate can break. So this can break. Why? Because it's already perforated. So there are high chances that it can break. So is the orbital plate, because that is also very thin. So anterior cranial fossa can lead to something called rhinorrhea and anosmia. What is anosmia? Loss of smell. Why? Because the olfactory nerves, which are the sensory nerves for smell, which pass through the cribriform plate would have been damaged. That's the reason the patient would experience this, candidate would experience this condition, anosmia, that is loss of smell. So that's how you are supposed to think. Is the frontal bone correct? No, it is not on the frontal bone. You remember, only the orbital plates are on the frontal bone. Don't get confused with this. Maxillary won't come into the picture at all. Maxillary has got nothing to do with the cranial fossa. So this is not. Zygomatic also has got nothing. Sphenoidal is from the middle cranial fossa. So that won't come into anterior. So all the time you have to remember, you have to learn to eliminate the wrong answer. This is very important. First, you learn to eliminate the wrong answer. You just, justify why you are eliminating it. I'm eliminating frontal because it is again on the sides. It is not in the center. Eliminating the maxillary because it is not part of the cranial fossa at all. So eliminate. So if you eliminate, you will get very few to pick from. So you are left with ethmoidal and frontal. You can get confused between ethmoidal and frontal, but you know that frontal is on the side and ethmoid is in the center. And then you can zero down on the ethmoid. So this is how you are supposed to answer. So you can zero down on the right answer. So many of them have mentioned. Yesh has been part of all my MCQs, And in fact, of all the MCQs that is taken by an academy, and kudos to you. I'm all the best to you because I see you very often, and Kipa as well. And I'm seeing Sam for the first time in my MCQs, I think, or in my classes, I think, and Rishabh too. Thanks for watching. And we have next question coming up. Let's see. All right, we have, yes, you're also part of the MCQs. I know that. Yes, in the walls of the orbit, the ethmoid bone contributes to formation of what? Now you have ethmoid bone, you have, see this is the orbit. This is the bony orbit, we can say. You can see the frontal bone which forms the orbital plate. This is the orbital plate, right? This is the squamous part. And then this is which portion? This is the roof. So we are talking about roof. Where is the floor? Floor is here. We have orbital surface. Sam is very quick. Saip is also very quick. But wait for 2 seconds. Let me read the question and the options. So you have floor that is formed by orbital surface of the maxilla here. And we have zygomatic bone. We have orbital process of the palatine bone as well. That is a small piece of palatine bone. And then you have medial wall. So we are talking about which one? We are talking about in the walls of the orbit, the ethmoid bone. So you know that ethmoid is in the center because anterior cranial fossa we studied, we saw that ethmoid was in the center. It cannot shift to the lateral part. It cannot shift to the floor. So it was in the center. It could be either roof or the medial wall, right? So I can get confused between these two things, either roof or the medial wall. Now let's see how to eliminate. Is it the inferior orbital wall? No, because inferior it won't come. Is it the lateral? No. Is it the superior or is it the floor? So is it the superior? Superior is also known as the roof. You have orbital floor of the frontal bone and then you have lesser wing of the sphenoid. But since it is in the center, it contributes. You can get always confused between the roof and the medial wall because you know that it is in the center. So you may think it forms the roof, but eyes are lateral. So this is the roof, not this is not the roof. So this is the roof and sides are the roof. So you have medial wall here, that is this one. So this lacrimal bone, ethmoid bone, and part of the body of the sphenoid bone. Okay, so sphenoid bone, ethmoid bone, and lacrimal bone form the medial wall. So here we have the ethmoid bone. So the answer is A, that is medial wall. So how many of you have written? Kipa has written, Sam has written, 5. Yes, Rishabh, right. So all of you think it is the A, option A. For 8th question, the answer is A. So don't get confused between medial wall and the roof. So think properly. If it was roof, eyes are not in the center. It is no, we don't have an eye in the center. We have it as a lateral structure, two lateral things on either side of the nose. So this ethmoid cannot become the roof. It can only become the medial wall. Okay, next question. 9th one. The artery exits the middle cranial fossa through the optic canal. Which artery? Now you know that the middle cranial fossa has got a fissure that is called superior orbital fissure, inferior orbital fissure, and then cutting through the superior you have this optic canal. This is the optic canal. And this will be the person's eyebrows. So this is the other side eyebrows. This is one eye. So this belongs to which eye? So here will be the nose. Okay, so this is the nose. Always optic canal is directed medially. So this side optic canal will be here. So it is directed medially. Okay, you remember this. This is not a lateral structure. It is a medial structure. And this is the superior orbital fissure, and this is the inferior orbital fissure. Now, already you all have started giving the answers. Ninth one, the option is ophthalmic. Let's see whether this is correct. How did you eliminate all the other things? We'll see. So now this is the medial structure. Now you can see two things. One is the nerve, another one is the artery. So here, this is the optic canal. So this is what is the optic canal. But what is this one? This is the tendinous ring. Anybody knows what are the attachments on the tendinous ring? Anybody knows what attachments are present on the tendinous ring? Anybody? Saif? Your answer is correct, D. But what is attached to tendinous ring? The recti. The 4 recti are present. 4 recti muscles take origin. So you have superior rectus, there is medial rectus, lateral rectus, and inferior recti. So all these extraocular muscles. True, but which one? The recti. No, not just lateral rectus. All the 4 recti are on the tendinous ring. So all 4, not just one. So you have superior. I told you this side is medial, this side is inferior, this side is lateral. So this is lateral. The optic canal is present medially. So this is medial rectus. Okay, so this is how you're supposed to come up with more questions. One single question should make you come up with 4 other questions. Okay, so it's not just you're stuck with one question and don't know if something else is asked. You have to learn to make more questions with one single question. Now here the other options are buccal. Is it buccal? Buccal is cheek. So it has got nothing to do with the cranial fossa. So stay focused on this. Underline the keyword middle cranial fossa. Has it got anything to do with the pterygoid? No, it is muscles of mastication. What about masseteric? No, that is also a supply to the masseter. This is from second part of maxillary artery. Okay, masseteric branch. And then you have ophthalmic. Ophthalmic is correct. Ophthalmic is the correct answer. Then you have deep temporal. What is ophthalmic branch? It's a branch from where? So ophthalmic is a branch from internal carotid artery. So how many questions I got? I got 1 question here. I could get 1 question here, and the original question was here. So out of one single thing, I could get 3 other questions. So out of 1 MCQ, I turned it into 3 or 4 MCQs. So this is how you are going to study. Okay, next one. Okay, the next one we have the posterolateral fontanelle is located at the posterolateral fontanelle is located at the. Now you have one part that is called inion. Now, when we spoke about all other things, did you notice that this is the only thing that is part of the cranial fossa? This is the only one. It is part of cranial fossa. What is this? It's part of infratemporal fossa. This is infratemporal fossa. Infratemporal fossa. This is also part of infratemporal fossa. So that is one interesting thing you can notice. All others are part of infratemporal fossa except, so this could be one question. All these are part of infratemporal fossa except, so except ophthalmic, which is a part of cranial fossa. Okay, next one. The posterolateral fontanelle, 10th one. The answer is okay. Saif says D, posterolateral. So this is anterior fontanelle. What is this? This is posterior fontanelle. Where is parietal? So now posterolateral. So this is a parietal bone. This is a parietal bone. You can see 4 fontanelles in its corners, correct? There is anterior, there is a fontanelle, that is sphenoid fontanelle, and then is a mastoid fontanelle. The sphenoid fontanelle is also called anterolateral. This is also called posterolateral. Okay, so now here, what is enion? Let's try to eliminate what is not belonging to this particular, answer. It's not a part of this option. We'll just try to eliminate first. Yash says D. Yes, your answer is correct. That is the answer is it D or E? Are you sure? Now, there is an answer option E as well. You're not thinking. That very clearly shows you're talking about posterior fontanelle, and here it is posterolateral fontanelle. Okay, posterior and posterolateral are not same. All right, so all of you, looks like all of you are wrong. Kipa changed her option. She made it as asterion. Yes, you're right. I don't know why you changed it. What is the reason? I wish we could talk. Okay, so now I have enion. What is enion? It is present on the external occipital protuberance, correct? Highest point. What is pterion? We already mentioned that is a H-shaped suture. That is this one, anterior fontanelle. What is bregma? Sorry, this is not that one. This is sphenoidal fontanelle, which is also called anterolateral fontanelle. What is bregma? That is this one, anterior. Okay. What is lambda? Lambda is nothing but posterior fontanelle. So the last one that is left is asterion. Asterion is this one, that is mastoid fontanelle. Here there are actually 3 lines that are fused. One is the parieto-mastoid. And then there is occipito-mastoid. And I have lambdoid suture. So all these 3 together, they form the asterion. So it's very important, how did you get asterion? By parieto-mastoid, occipito-mastoid, and lambdoid sutures. 3 sutures, meeting point is asterion. So 4 things is pterion, 3 is asterion. So you can see 3 things. So 1, 2, and the other one 3. Okay. Next one. Hi, Rishi Patel. Rishi Patel sent some hugs. Thank you. I'm happy that you're liking the MCQs. You're making it more interactive by answering, and it's really nice. Okay, next one. The presence of fontanelles is due to the delayed ossification of 4 angles of which bone? You know that these cranial bones, they have a different types of ossification. What is the type of ossification? Anybody knows? Ruchi Patel, do you know what is the cranial bones ossification? It is membranous. So which other bones undergo such ossification? Part of mandible. Only part of, not everything. Then clavicle. Okay, this is membranous ossification. So there is a condition in clavicle when it doesn't undergo membranous ossification. When there is a defect in membranous ossification, it forms, it has a condition called cledocranial dystosis. What is this not happening? It's a condition. Osis is a condition where it is not happening. Cledo is clavicle, cranial bones. So there is a defect in membranous ossification. Okay, such an ossification defect is called cledocranial dystosis. So now here the answer, someone says 11th one. The presence of fontanelles is due to the delayed ossification of the parietal. So is it correct? The parietal is correct? Yes. So when does it start? Now all the bones, they start their ossification between, 6th to 7th week of intrauterine life. You should remember. So roughly you say that about 7th week of intrauterine life. So this is the bone which should start at 7th week of intrauterine life. And then where it starts at the parietal eminence. This is the parietal eminence and it starts radiating in all directions. Okay. So it starts radiating. Which one? The ossification continues in that direction. But by the time it reaches the corners, by the time it reaches this corner and this corner, it takes a long time. It takes a long time. So it gives this gap called the fontanelle. So all the four corners of parietal bone have got this fontanelles. So you understood why there is fontanelle, because the parietal bone starts ossification from the center and it radiates to the corners. So by the time it reaches the corners, it takes so much time and the corners remain completely membranous until then. And hence the gap that is called fontanelle. Okay, so your answers are correct. That is Deborah, you're right. Deborah McCurry, you are right. And then Kipa right, Sam right. Yeah, most of you are right. All right, we'll see next question. Just give me a second. Okay, next question. The nerve that provides motor supply to the tongue emerges from the cranial cavity through a canal in the what bone? So you're talking about motor supply. Remember, motor is for muscles. So first you remember that. Then they're talking about tongue. Okay. So tongue, which nerve? Which nerve? Which nerve supplies the tongue? The supply of tongue is by hypoglossal. Anybody? Hypoglossal. So the supply is by hypoglossal. So hypoglossal nerve emerges from hypoglossal canal. Where is this hypoglossal canal? This one, yes, you are right, Kipa. It is hypoglossal. Sam, you are right. Yes, you are right. All of you. Yes, Yesh has not written what is the answer. It is just 12. But what is your answer? You wrote the question number, that is 12. Write the answer. Okay, that is hypoglossal. So you have hypoglossal canal that is present in the last portion in the posterior cranial fossa. And the answer is occipital. So the answer is occipital. So hypoglossal canal and so what are the foramen you have in the occipital bone? You have condylar canal. You have mastoid foramen. You have foramen magnum. So you have 1, 2, 3 of them. So all these are present in the posterior cranial fossa. You have only 3. You have only 3 foramen. But where is this jugular foramen? It is not present in the posterior cranial fossa. It is present between the petrous part and the occipital bone. It is not part of the posterior cranial fossa. I think that question is there. So it is again part of the occipital bone, the hypoglossal canal. Okay, next question. Let's move on to the next one. Yes, yes, it is E. Okay, what foramen is located between the occipital bone and the petrous part of the temporal bone? This is the petrous part of the temporal bone. Temporal bone has got 5 processes actually. So it has got a squamous part, it has got a petrous part, it has got a styloid part, it has got a mastoid part. All right. So it has got a zygomatic part. So all these are the parts of the temporal bone. So out of this, the petrous part and the occipital bone, they have a small gap, and the gap is known as jugular foramen. This is the jugular foramen. And what passes through jugular foramen? You have 9th, 10th, and 11th cranial nerves passing through this. So this jugular foramen, 9th, 10th, and 11th cranial nerves plus the sigmoid sinus and inferior petrosal sinus. So all these pass through jugular foramen, and the answer is B. Yes, you're right. So 9th, 10th, and 11th cranial nerves. Yes, it is B. Answer is B. Keeper also says the cranial nerve names, and Yesh also mentions the same thing. So it is B. Okay, next one. Internal acoustic meatus is a canal with the which bone? So now you have internal acoustic meatus. Where is this internal acoustic meatus? It has got something to do with the ear, right? Acoustic ear. So where is this? It is in the middle cranial fossa. So middle cranial fossa, which bone is there? Sphenoid is there. Temporal is there. So any part of the sphenoid is associated with ear? No. What about temporal? Yes. So we have the temporal bone, which has the petrous part. It has the internal acoustic meatus. So what structure passes through internal acoustic meatus? So 7th and 8th cranial nerves. Now into 7th and 8th cranial nerves. Now what happens to the 7th cranial nerve? Now you know that 7th and 8th cranial nerves take origin from pons actually, and then they enter the internal acoustic meatus. Okay, then it has to enter the, this is present in the petrous part. Then the 8th nerve will stop inside the middle ear, and 7th one continues its journey. Correct? What is that journey known as? Intracranial course. Then it exits out of stylomastoid foramen to form extracranial course. Then it goes to the parotid gland. Then it comes on the face, 5 branches. 5 branches on face. Okay, what these branches are called? These branches are called motor branches of 7th cranial nerve, that is facial. Okay, so this is what I wanted to tell you. 7th and 8th cranial nerve start at pons as you know, twins, but later on 8th one will have to stop. What is the function of 8th one? It is a sensory, it is purely sensory. Okay, 8th one, vestibulocochlear, is purely sensory. It stops in the ear. But 7th one doesn't have any work in the ear. Its job is to supply the face, the facial expression muscles. So it comes to the face through this route and ends as 5 branches like goose feet on the face. Okay, next one, probably this is the last one, that is okay, 15th one, the acoustic labyrinth is situated within the part of temporal bone. So within dash part of the temporal bone. So now again we are talking about acoustic. We have to remember acoustic has got something to do with the temporal bone. So it is it squamous part, tympanic part, styloid part, and zygomatic process. I told you temporal has all these as the 5 different parts. So you have petrous part, which has got this acoustic labyrinth. That is, it has the internal acoustic meatus as the opening. And this is also present, and this is the answer. Okay. So this is the answer. This internal acoustic meatus, in this region you have acoustic labyrinth is present, and that is present in the petrous part of the temporal bone, which is part of the temporal bone. Squamous, no, squamous actually is outside here, and then tympanic will not be part of that. Tympanic again is forming the external ear. And then styloid process, there are 3 muscles plus 2 ligaments attached to it. Zygomatic process, it forms the, attachment for temporal fascia. Fascia attaches to the zygomatic arch. So that is its function. And also the masseter muscle attaches to this. Masseter muscle. So these two attach to zygomatic process. So the thing that we have to zero down on is petrous part that has got internal acoustic meatus. That is where you have this acoustic labyrinth, and that is part of the temporal bone. So I think with that we come to an end. If you have liked all these MCQs and you were able to answer and it was interesting and stimulating your brains, please subscribe to Unacademy app. Go to the app and use the code ROHINI to watch all my YouTube classes daily at 6 p.m. and 9:30. So it is daily. So please watch. We'll discuss more each day. It will be a different topic. We will make you thorough in every topic. So watch 6 p.m. and 9:30 p.m. classes. Thank you so much. Thanks, Skipper. Thanks for your compliments. Thanks, Sam. Next MCQ questionnaire will be 9:30. All the MCQ based will be on everyday basis at 9:30. So any topic discussion will be at 6. So if it is always nice if you attend 6 p.m. topic discussion as well, because you will get a lot of new things that you can look for. And then MCQs you can answer only if you know the subject well. So it is always important that you attend both. So we look forward to you all. Thank you, Ash. Thanks, everyone.